If your knee hurts, the location of the pain can tell you a lot about what's causing it and how to fix it. In this video, I'll share some of the most common causes of knee pain by location, plus my top tips for relief. Now I'll break this video up into 3 sections: causes and treatments for pain on the front of the knee, on the sides of the knee, and the back of the knee. So let's get started with causes of pain on the front of the knee. The first one we'll discuss is pain just above the kneecap, and that often comes from quadriceps tendinopathy. Your kneecap sits inside the tendon of your quadriceps muscles, and that continues down past the kneecap into the patellar tendon. So you can also have pain from the patellar tendon, often referred to as patellar tendinitis or inflammation of the patellar tendon. But most of the time, tendon problems are not actually itises or inflammatory problems, but rather tendinopathies where there's no inflammation and abnormal healing, which means ice doesn't always work for those types of problems. We'll go through some tips on how to load the tendons more properly in order to help them heal here in just a moment. But I first want to cover some other causes of pain on the front of the knee. If you have pain right in front of your kneecap, it's kind of puffy and you can feel that it's in front of the kneecap, not behind the kneecap. That's often from prepatellar bursitis. And in that case, it is actually an itis or an inflammation where the patella or fluid-filled sac in front of your knee gets inflamed. And that often happens from direct trauma, whether you get hit in the front of the knee or whether you fall on your knee, or maybe you spend a lot of time on your knees for your job. That can all create inflammation of the bursa. In that case, you do want to treat it like an inflammatory problem. Ice, compression, elevation, rest are all good treatments for a bursitis problem on the front of your knee. Now, pain that's behind your kneecap, it feels kind of deeper in, that can be caused by kneecap arthritis or a more mild form of that called chondromalacia patella. Now, whether it's chondromalacia or kneecap arthritis, that basically comes from abnormal force or loading behind the kneecap. Typically, that's from overusing your quadriceps or having quadriceps that are too stiff or tight, creating compression behind your kneecap and in front of the thigh bone. It can also come from abnormal tracking of your kneecap. If your kneecap goes too far inwards, but more commonly too far outwards, you can start to rub the outer part of your patella or kneecap up against the thigh bone, again creating inflammation behind the kneecap. Now, how do you fix front of knee problems? Well, in general, other than direct trauma to your prepatellar bursa, most front of knee problems that are in the midline are caused by front to back plane problems. That's typically abnormal loading of the quadriceps, usually overutilizing your quadriceps because either your glute muscles, particularly your gluteus maximus, is too weak, or because your ankle or calves are too stiff. So we'll go through solutions for both of those right now. When you bend your knee, especially when you're loading, you use a combination of your quadriceps and your glutes in order to help lower you down and push you back up. Now, if you put your weight too far on your toes and not enough on your heels, when you're doing something like squatting, lunging, or going up and down stairs, you'll utilize your quadriceps more and your glutes not enough. And so one tip is just to keep your weight more on your heels when you're doing something like squatting. Now, furthermore, your quadriceps need to lengthen as they're producing load. That's called eccentric strength. It means that your quadriceps can lengthen while trying to shorten at the same time. So doing slow eccentric movements like squatting down slowly as far as you feel comfortable going, whether that's just a mini squat to start out and going down slowly to help with that eccentric lengthening, can be helpful for kneecap problems, particularly quadriceps tendinopathy or patellar tendonitis. Now, if you have pain directly behind your kneecap, arthritis or chondromalacia, direct stretching of your quadriceps where you pull your heel towards your bottom may not necessarily be the best solution. Because if your quads are already tight, it just creates further compression of your kneecap on your thigh bone. And that's why doing eccentric loading, going down slowly, just as far as you can comfortably, and then coming back up is often a better option. Now, there's another common cause of pain on the front of the knee that may give you trouble when you're doing squatting or eccentric loading, and that's stiffness in your ankle joint and or in your calves. When you squat down, you need your knees to move forward over your toes. Now, if you don't have enough flexibility in your ankle joint or in your calves, as you go down like this, your heels come up off the floor. And you really need to be able to drive through your heels in order to activate your glutes. And so if you have stiffness in your ankles or calves, your heels start coming up off the floor, and then you start using more quadriceps and not enough glutes. So here are a couple mobility tips to improve the mobility in your ankle joints as well as your calves. This first one is a joint mobility tip for your ankle, because if you don't have enough mobility in the ankle, it doesn't matter how flexible your calves are, because you're going to get stuck or get a pinching in the front of your ankle. That's sometimes referred to as impingement. There's a little bone that sits in between the two bumps on the outside of your ankle, and that bone is called the talus. As you move your knee forward over your toes, the malleoli, the bumps, have to glide forward, or relatively the talus has to glide backwards in order that you get sufficient mobility of getting your knee forward over your toes. So to help with that, we're going to take a belt. You can also use a stretching strap or a dog leash and put it right at the bend of your ankle here. Put your foot up on a chair. Usually a firm surface works a little better than a couch. We'll make do with what we have here. And then going forwards like this, you want to pull backwards with the belt or the step. You want to pull backward with the belt or the strap, and that allows you to move forwards while pulling the talus backwards in the ankle joint. Repeat this process for about 30 seconds to a minute, and then try doing something like squatting or lunging and see if it feels a little bit more comfortable. Now, if it doesn't feel more comfortable, then you may also have to stretch your calves. The calves are the next thing in line that's going to stop you from getting that ankle dorsiflexion or knee over toe movement. And you have two calf muscles. You have the more superficial gastrocnemius muscle and then a deeper soleus muscle. The gastrocnemius muscle crosses the knee, and so it can limit your knee extension, especially when you have your heel on the floor. And so to stretch the gastrocnemius, you'll put your heel flat on the floor, toes pointed straight ahead, and then move your body forwards over your foot only as far as you can without your heel coming up off the floor. Now, many people do make the mistake of allowing their foot to flatten or pronate, or allow their toes to turn out when they're stretching their calves. And you don't want to do that. You want to keep an arch in your foot so that your knee goes directly over your toe when you're stretching your calves. And so from the other side, it would look something like this. Now, that stretches the more superficial gastrocnemius muscle, but it doesn't quite target the soleus. The soleus, because it doesn't cross the knee, often can go a little bit farther than the gastrocnemius. And so by bending your knee, you can take the gastrocnemius out of it, and you'll notice if this is as far as you can stretch the gastrocnemius, if you bend your knee a little bit, you'll usually be able to go a little bit farther just stretching your soleus. And so do those two stretches holding for about a minute each. Now, if you don't have enough flexibility in your ankles and calves and still want to be able to develop that eccentric strength in your quadriceps, but it hurts too much because you don't have the mobility in your ankles, there is another tip that you can use to help. Doing squats with your heels on weights, whether it's dumbbells or weight plates or a 2x4, something to lift your heels up a little bit allows you to still get pressure through your heels so you can activate your glutes while also doing eccentric strengthening on your quads. This often allows you to keep your trunk more upright versus if you're squatting on the floor, you may have to counterbalance by leaning forwards a little bit more. So put the heels up on the weights and then squat down. Again, whether it's just a partial squat, do what you can comfortably, or whether you can squat all the way down. Next, we'll move on to causes of pain on the inside and the outside of the knee. I'm grouping these together because there's no real muscles that move your knee in the side-to-side direction. Primarily, the movements of the knee joint are front to back. So the side-to-side movements of the knee are accessory motions. And when you move one way, you compress one side of the knee and gap the other, and vice versa. So these two movements often go hand in hand, and you'll see when we get to the treatments portion of this that a lot of the treatments are the same, regardless of whether you have inner knee pain or outer knee pain. But first, let's get started on the causes. If you have pain right at the joint line, right where the knee bends, then that can be from something inside the joint. Typically, it's either arthritis or the meniscus, the fibrocartilage disc that gives the knee a little bit more depth and a little bit more stability. Next, if it's right along the inside, kind of in a band like this is your MCL or medial collateral ligament. And the MCL resists against valgus forces of the knee like this. The MCL is incredibly strong, so it's very rare to injure it just by happenstance. There's usually a traumatic injury that goes along with it. You may hear or feel a pop, and sometimes that's also coupled with a medial meniscus injury and or an ACL injury. So if you do hear a pop or if your knee feels a little bit unstable, definitely get it checked out by a doctor. The next thing that can cause inner knee pain, and this is one of the most common ones that I see, are the tendons that wrap around just on the inside of the knee. There are actually 3 of them, and collectively they're referred to as the Pez-Anserine tendons. One of them is the sartorius. It's a muscle that comes along like this. The next one is a gracilis, one of your hip adductors that moves your knee in this way. And the third one is actually one of your hamstring muscles that starts out in the back of the leg and then wraps around this way, called the semitendinosus. And those 3 muscles attach on the inner shin just below the knee. And so if you notice that your knee pain is not right at the joint line, but just a little bit below it, it could be an irritation of one of those 3 tendons or the bursa that's right around that area. Now moving on to causes of outer knee pain. On the outer knee, you've got the lateral joint line, which much like the medial can be either lateral compartment arthritis on your knee or the lateral meniscus inside the joint. The pain going from here to here vertically can be the LCL or the lateral collateral ligament. You may find a bump right here on your knee, and if you trace upwards from that bump, that's generally where the LCL runs. Again, it resists the opposite. It resists varus or forces going that way on your knee, and typically that's injured with a traumatic injury as well. Furthermore, that fibular head right here can also create knee pain. There's a joint where that fibular head moves back and forth between the fibula, the small bone in your lower leg, and the tibia, the large bone in your lower leg. And a dysfunction in that joint often can create outer knee pain when you bend the knee fully. Furthermore, there's a nerve that runs behind there, a branch of your sciatic nerve known as the common fibular nerve. And that can also get pinched behind that fibular head, again, often when you're bending your knee fully. Now, one of the most common causes of outer knee pain is IT band syndrome. And your IT band, or iliotibial band, is a big long band of fascia, basically like a tendon, that runs from your pelvic bone or ilium down to your tibia or lower leg bone. The IT band can get irritated during activities that require moving your knee back and forth repetitively, particularly running or cycling, and particularly if your technique is less than ideal. So how do you fix causes of inner or outer knee pain? Again, they're different sides of the same coin, so a lot of times the solutions for one will also fix the other. But unlike front to back problems for midline knee pain, these come from side to side or rotational movements of the knee. Now, when you walk, if you overpronate your foot, your knee goes inwards like this, and relative to your thigh bone, the tibia is rotating outwards. So a lateral rotation of the tibia on the femur is one very common cause of both inner or outer knee pain, depending on where the maximum stress is. You can also get a glide in one direction or the other, where the tibia shifts inwards or shifts outwards on the femur. And either of those can create inner or outer knee pain as well. Now, oversupination, walking too much like that, can in theory also create problems. It creates compression on the inside of the knee, which can be problematic if you have inner knee arthritis, or it can create stretch or tension on the LCL or lateral collateral ligament. In practice, these don't tend to come into play quite as much. I do actually have another video on both the varus knees and valgus knees if you have knee arthritis, and I'll refer you to that video for solutions on those problems. But in this one, I want to discuss the rotational problems, particularly that lateral rotation of the tibia and the shift outwards and the shift inwards. Because correcting those subtle joint problems in the side-to-side and rotational plane can often provide really quick relief from knee pain. One of my favorite ones is just crossing your leg like this, kind of like you're doing a figure four or piriformis stretch. You're going to make a slight modification. And that's taking this hand, the opposite from the cross leg, and putting it just below the joint line, just below where your knee bends. Then take the other hand and put it on the inner knee. Now you're going to push outwards with this one while pulling inwards and twisting inwards with this one. This creates both a medial glide of the tibia on the femur, or an inward glide, as well as an inward rotation. So it can help fix a outward rotation or an outward glide of the tibia on the femur. So grab like this along the shin, push like that on the thigh bone, and then go like this. Now, this is typically my go-to for people with subtle knee joint problems. You can run your fingers down and kind of feel if your tibia steps off one way or steps off the other way from your thigh bone. But with untrained hands, if you're not quite experienced for what you're feeling with, this may not be easy to tell. So I typically tell people, if they're uncertain, to start with doing this and just pushing here, pulling and rotating here. And you can do little tiny oscillations, or what's easier is probably just to hold a sustained stretch. Do this for about a minute, whether you hold it for the entire minute or whether you need to take some breaks and oscillate a little bit. And then recheck and see if your symptoms are better. If they are better, that's great. You probably did the right thing. If they're no better, or if they're slightly worse, then it probably wasn't the correct technique. But the good news is, by doing the opposite, you can usually fix that rather quickly. So we were just doing a medial glide and rotation of the tibia on the femur, something like this. And this is another alternative technique for a medial glide of the tibia on the femur. is putting this hand here on your thigh bone or femur and pushing inwards. But if you found that the other one didn't work or this one didn't work, just switch directions. So you put the hand below the shin and then the other one on the outside of the femur, and then just push this way. So now it's the opposite direction. You're gliding the tibia outwards and the femur inwards, and this corrects the opposite problem. And again, do this for about a minute, and then recheck and see if your symptoms feel any better. Now, those are great quick fixes, but they don't fix the underlying problem, which again is usually excessive pronation like this. Now, if you have stiffness in your ankle joint or your calves, your ankle is a triplanar joint, meaning it moves through all three planes of motion at the same time. So problems in that front to back problem in your ankle can also create side to side issues. So doing the calf stretches or the ankle mobilizations that I showed earlier can be helpful. Additionally, when you're walking, you want to think about keeping your arch slightly domed so that you don't overpronate. Don't let the arch collapse when you're going to take a step, but just activate your foot muscles by trying to pull the ball of your foot towards the heel of your foot. That slightly helps maintain the arch of your foot as you're walking so that you don't overpronate or flatten your foot, causing your knee to move in directions that it may not be well suited to move. Now, before we move on to the last section, if you're finding this video helpful so far, take a moment to hit the share button below this video and share it to your Facebook page. I'll bet there's at least one of your Facebook friends who's having some knee trouble and could benefit from seeing this video. Thanks for doing that, and let's get on with pain in the back of the knee. That can be caused by a hamstring problem, either the tendons of your inner hamstrings or your outer hamstrings. It can also be caused by the muscles in your calves. Remember, your gastrocnemius, your more superficial calf muscle, crosses over the back of the knee. And so trouble in the medial or inner head of the gastrocnemius can cause back inner knee pain, or trouble in the outer head of the gastrocnemius can create back outer knee pain. If you have pain right back here on the outer side of the knee, particularly when you're bending, keep in mind that could also be the fibular head or the common fibular nerve that we discussed earlier. Now, one of the most common locations of pain on the back of your knee is that soft spot right below where the knee bends. And there are several different things that can cause that. Usually it's due to some type of swelling or inflammation inside the joint. Whether it's an ACL or PCL problem or anterior cruciate ligament or posterior cruciate ligament or a meniscus tear or arthritis, anything that causes swelling inside the joint capsule, this is the area where swelling will tend to drain with respect to gravity. It's the most loose part of the knee, and particularly when you're sitting, it's downwards, and so swelling will tend to drain into this back part of the knee. Additionally, you may have something known as a Baker's cyst, which is essentially a fluid-filled sac in the back of the knee that makes it either really stiff to straighten or makes it really tight to bend. Much like the MCL or the LCL ligaments, the ACL and the PCL are very strong ligaments. So if you tore one, you would probably know it. It's usually from a traumatic injury. But either way, if you're having pain in the back of the knee, and particularly if you're having swelling in the back of the knee, probably a good idea to get it checked out. However, in the meantime, here are some tips to help if you're having trouble straightening the knee or bending the knee due to pain and swelling in the back of the knee. If you can't straighten your knee fully because it feels stiff or tight in the back of the knee, it could be from a hamstring problem if you're sitting up like this where the hamstrings are on tension, or it could also be from a joint problem where the knee joint doesn't extend fully. And that's particularly if you're laying backwards like this and you still can't get the knee to straighten all the way. Now, one way to help if you have a knee joint problem is just to take a little towel and put it behind your lower leg bone or tibia. Put it pretty close to the joint line And then you can also back that with your other hand if need be. Now take this hand and put it right on the top of the thigh bone, again, very close to the joint line. And then it's just going to be a subtle push like this. This shouldn't be an arcing motion where you're pushing your knee down that way. It's a translation. So the towel and this hand are kind of translating the shin bone or tibia forwards, while this hand is translating the femur backwards. And then it's just a very subtle oscillation. This gets the joint gliding a little bit better, which helps you to further straighten the knee. Now, if you're having trouble bending the knee, whether it's because of swelling in the back or because that tibiofibular joint on the outside here is moving very well, you can take a towel and put it behind your knee. You may have to vary how thick it is, but find a thickness of towel that fits behind your knee comfortably. Wedge it up in there, and that helps push the fluid back up into your knee. It also helps mobilize this tibiofibular joint right here. So you put the towel in like this, and then just pull your knee up this way. This helps kind of gap the knee joint, pushes the swelling back through the joint, and also mobilizes that tibiofibular joint. You can do little oscillations like this, or just pull and hold it for a sustained stretch. And again, do this stretch for a total of a minute, whether you're just doing a sustained hold or whether you're doing oscillations. Now, those were just some of the most common causes of knee pain and a few of my favorite tips on how to relieve them. But keep in mind, there are all kinds of different types of knee pain, and everyone's experience is different. So do get it checked out by a healthcare professional. And if you'd like more tips on how to relieve knee pain, check out my knee pain relief playlist right over here. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.